Warning signs of colon cancer you should never ignore. Colon cancer is more common than most people think. It's the third most diagnosed cancer worldwide and a leading cause of cancer-related deaths. In the United States alone, nearly 153,000 new cases are expected this year, with tens of thousands of lives lost to the disease. Yet many still overlook the early signs of colon cancer, assuming it's just a minor digestive issue. The truth? By the time symptoms become severe, the cancer may already be in an advanced stage. And here's the kicker. Colon cancer screening could prevent most cases if done at the right time. But why is colon cancer so prevalent? Lifestyle factors play a significant role. A diet high in processed foods, low fiber intake, and sedentary habits all contribute to a higher risk. Genetics also have a say. If a close family member has had colon cancer, the risk doubles. That's why knowing when to screen for colon cancer is crucial, especially if there's a history of the disease. But here's what's frustrating. Many people delay getting a colonoscopy because they assume they're too young or feel fine. Unfortunately, this mindset can be deadly. What's even more alarming is that colon cancer is rising among younger adults. Decades ago, it was mostly seen in people over 50. Now doctors are diagnosing it in those as young as 30. Some even mistake their symptoms for IBS colon cancer overlap, dismissing red flags like bloody stool or chronic digestive issues. This shift has experts questioning whether environmental factors, stress, or even modern diets are fueling the trend. But here's the good news. Early detection saves lives. So how does colon cancer even begin? The answer might surprise you, but before we dive in, please take a second to like this video, subscribe, and share. It's free, and it truly helps us continue bringing and spread this valuable information. Colon cancer doesn't appear overnight. It starts as small, harmless growths in the lining of the colon called polyps. At first, these polyps are benign, causing no symptoms, which is why most people have no idea they even exist. But over time, some of these polyps can turn cancerous, developing into a tumor that grows and spreads. The good news? If caught early, colon cancer is one of the easiest cancers to treat. In fact, a simple colonoscopy doesn't just detect the disease, it can remove polyps before they become a problem, acting as both diagnosis and treatment in one step. But what triggers these polyps to turn into colon cancer? A mix of genetic mutations and lifestyle choices. Some people inherit a higher risk, but for many, diet and inflammation play a bigger role. A diet heavy in red meat and processed foods combined with a lack of fiber can fuel polyp growth. Chronic inflammation, often seen in conditions like IBS colon cancer misdiagnosis, can also create an environment where cancer thrives. And let's not forget the role of gut health. An unhealthy microbiome might be a missing piece in understanding how to detect colon cancer before it becomes life-threatening. The real danger lies in late detection. In its early stages, colon cancer is highly treatable, with survival rates exceeding 90%. But once it spreads, treatment becomes far more difficult, requiring aggressive therapies like chemotherapy and surgery. That's why catching it early is critical. So stay with me until the end, because this video might just be the most important one of your life. And one of the first clues? Subtle changes in bowel habits that many people overlook. Most people don't pay much attention to their bowel habits until something feels off. Colon cancer often starts with subtle shifts in how your digestive system behaves. Maybe you've always been regular, but now you're experiencing diarrhea that won't go away or constipation that feels different from the usual. These changes might come and go, making them easy to ignore. But when bowel habits stay irregular for weeks without a clear explanation, it could be a warning sign that something deeper is happening inside the colon. Diarrhea can occur when a tumor partially blocks the intestine, forcing the body to expel waste more quickly. It may also be linked to inflammation in the colon, which disrupts normal digestion. In some cases, mucus production increases, leading to loose stools that are different from typical bouts of diarrhea caused by food or infection. If diarrhea persists without an obvious reason, especially when accompanied by other symptoms, it's a red flag worth investigating. On the other hand, constipation happens when a growing tumor narrows the passage inside the colon, making it harder for stool to pass. This can cause infrequent bowel movements, straining, and a feeling of incomplete evacuation. Some people assume it's just due to dehydration or diet, but if constipation is persistent and doesn't improve with simple dietary changes, it could indicate something more serious. And speaking of signs that shouldn't be ignored, let's talk about something even more concerning: unexplained weight loss. One of the more alarming symptoms of colon cancer is unexplained weight loss, and it often occurs early in the disease. If you're losing weight without changing your eating habits, exercising more, or undergoing any lifestyle changes, it could be a sign that something is wrong. In the case of colon cancer, weight loss happens when the body is unable to absorb nutrients properly because the tumor interferes with digestion or the way the colon absorbs water and food. Your body may start using its fat stores for energy, leading to a noticeable drop in weight even if you're eating normally. Another reason for weight loss is the increased metabolic demands that cancer puts on the body. As tumors grow, they release certain substances that can trigger changes in your metabolism, leading to a decrease in your appetite and an overall feeling of fatigue. This can make it harder to keep weight on. The body might also start burning more calories than usual to fuel the cancer's growth, causing significant weight loss despite no change in diet. This symptom is particularly concerning because many people simply chalk it up to stress or aging. However, if weight loss is sudden or unexplained, it should be taken seriously. The sooner you see a doctor, the sooner you can rule out serious conditions like colon cancer. And if you're noticing weight loss alongside other digestive changes like blood in stools, you shouldn't wait to get checked out. Seeing blood in stool is one of the most obvious and alarming signs of colon cancer, and it should never be ignored. Blood can appear in several ways: bright red, dark, or even mixed in with the stool. The color and appearance of the blood can give clues about where the bleeding is occurring in the digestive tract. Bright red blood is usually a sign of bleeding in the lower part of the colon or rectum, while dark stool or black stools could indicate bleeding higher up in the colon. This is often caused by a tumor that's bleeding slowly over time. The presence of bloody stool may also be due to a growth or a tumor in the colon, causing damage to the lining of the intestine. When the tumor interferes with the blood vessels inside the colon, it can lead to bleeding. As the blood passes through the intestines, it may change color, leading to either bright red or dark-colored stool, depending on how much time the blood spends in the digestive tract. Even a small amount of blood can indicate a serious problem, so if you notice blood, even in tiny amounts, it's crucial to consult with a doctor. Sometimes blood in stool can be confused with hemorrhoids or minor anal tears, but it's important not to assume the best-case scenario. Regardless of the cause, blood in stool should always prompt a visit to the doctor. If you're noticing blood along with increased discomfort or changes in your bowel movements, it might be time to pay attention to another often overlooked sign: iron deficiency and anemia. As the body loses blood over time due to internal bleeding, iron deficiency can develop, leading to anemia. This occurs when there isn't enough iron to produce healthy red blood cells, which are responsible for carrying oxygen throughout the body. In cases of colon cancer, slow and chronic blood loss from the tumor can deplete iron stores, often without obvious signs of bleeding. Over time, this can cause persistent fatigue, weakness, dizziness, and even shortness of breath, symptoms that many people mistakenly attribute to a busy lifestyle or lack of sleep. One key indicator of iron deficiency anemia linked to colon cancer is an unexplained drop in energy levels. If you find yourself feeling exhausted after simple tasks, struggling to focus, or looking paler than usual, it could be a sign that your body isn't getting enough oxygen due to low red blood cell production. This type of anemia doesn't happen overnight. It develops gradually, making it easy to overlook until it becomes severe. A simple blood test can reveal whether your iron levels are low and whether further investigation, such as a colonoscopy, is necessary. Of course, iron deficiency isn't always caused by colon cancer. It can stem from dietary deficiencies, heavy menstrual periods, or other medical conditions. But when paired with other symptoms, especially changes in bowel habits or blood in stool, it raises a red flag that shouldn't be ignored. Up next, we'll talk about another subtle but telling symptom: the persistent feeling of fullness after a bowel movement. A bowel movement should bring relief, but what if it doesn't? Some people with colon cancer experience a constant feeling of fullness, as if they haven't completely emptied their bowels. This isn't just an inconvenience. It could be a sign that something is physically blocking the passage of stool. When a tumor grows inside the colon, it can partially obstruct the intestines, making it difficult for waste to move through properly. The result? A lingering sensation of pressure or fullness, even after using the bathroom. This feeling is not just about discomfort. It can also lead to frequent trips to the restroom with little to no relief. Some may describe it as a sensation of never being done, while others might feel a dull ache in the lower abdomen. This symptom is sometimes mistaken for irritable bowel syndrome, IBS, or dismissed as diet-related bloating. However, if it persists, especially when paired with tenesmus, it's important to consider colon cancer screening. Of course, an occasional sense of fullness isn't necessarily alarming, but when it becomes a pattern, it warrants medical attention. If you constantly feel like you haven't finished a bowel movement or experience ongoing discomfort in your lower abdomen, it's time to dig deeper. Speaking of persistent urges, let's talk about another symptom that often gets overlooked: tenesmus. Imagine feeling like you urgently need to use the bathroom, only to sit down and barely pass anything, or nothing at all. That's tenesmus, a symptom where the body keeps signaling the need for a bowel movement, even when the rectum is empty. This frustrating and sometimes painful sensation is often linked to conditions like IBS, but when it becomes persistent, it can also be a warning sign of colon cancer. A tumor growing in the rectum or lower colon can irritate the bowel lining, triggering false signals that make it feel like there's still something left to pass. Tenesmus isn't just an annoyance, it's a sign that something is interfering with normal digestive function. It can cause straining, cramping, and a constant sense of incomplete evacuation. Unlike constipation, where stool builds up, tenesmus creates the urge to go even when there's little or no stool to pass. If this symptom appears alongside blood in the stool, persistent changes in bowel habits, or unexplained weight loss, it's crucial to seek medical evaluation. A colonoscopy or stool test can help determine whether colon cancer or another condition is causing the issue. Many people dismiss tenesmus as a minor irritation or chalk it up to stress and diet, but if you're experiencing this regularly, it's worth investigating. Your body is trying to tell you something, and ignoring it could mean missing an early warning sign of colon cancer. But tenesmus isn't the only way your body signals trouble. Another symptom that often gets overlooked: persistent nausea and vomiting. Feeling nauseous every now and then isn't unusual. Maybe you ate something that didn't sit well, or you're just feeling off. But when nausea and vomiting become frequent, persistent, and seemingly without cause, it could be your body trying to tell you something more serious. In cases of colon cancer, a growing tumor can start affecting digestion, slowing down the passage of food and leading to episodes of unexplained nausea. This isn't the kind of discomfort that goes away with rest or hydration. It keeps coming back, sometimes even after eating light meals. When a tumor starts partially blocking the intestines, it can prevent food from passing normally. This can create a buildup of pressure, triggering nausea and, in some cases, vomiting. Some people notice that they feel full very quickly, while others experience what seems like indigestion that never really improves. It's easy to mistake this for food poisoning or an upset stomach, but the key difference is persistence. If nausea lingers for weeks without a clear reason, it's time to pay attention. Ignoring persistent nausea can be dangerous because by the time symptoms become severe, the blockage may have worsened. If you're also experiencing bloating, constipation, or abdominal pain, it could be a sign that something is interfering with normal digestion. And speaking of abdominal pain, that leads us right into the next warning sign: pelvic or abdominal pain. Occasional stomach pain is normal. Maybe you ate too fast, had too much fiber, or are dealing with stress. But when abdominal pain becomes persistent, sharp, or cramp-like, it's a sign that something deeper is happening. Colon cancer can cause discomfort in the lower abdomen or pelvic region, especially as a tumor grows and starts pressing against surrounding tissues. Some people describe it as a dull ache that never fully goes away, while others feel sharp, localized pain that worsens over time. The location and type of pain can vary depending on where the tumor is. If it's in the left side of the colon, you might feel cramping and bloating that comes and goes. If it's in the right side, the pain might be more subtle but accompanied by iron deficiency anemia due to slow internal bleeding. In more advanced cases, tumors can partially block the intestines, leading to intense cramping, gas buildup, and even vomiting. If these symptoms persist despite dietary changes, it's worth investigating further. Pain that seems random but keeps coming back or gets worse over time is a red flag. Many people dismiss it as gas, IBS, or stress-related discomfort, but persistent abdominal pain, especially when paired with other symptoms like blood in the stool, unexplained weight loss, or changes in bowel habits, should never be ignored. Now that you know the warning signs of colon cancer, the real question is, what will you do with this information? Will you brush it off and assume everything is fine, or will you take control of your health? The truth is, many people ignore symptoms until it's too late. But early detection can mean the difference between a simple treatment and a life-threatening battle. So if you've noticed persistent changes in your bowel habits, unexplained weight loss, blood in your stool, or ongoing discomfort, don't wait. Talk to your doctor, schedule a colonoscopy, or at the very least, get a stool test. Think about it. How much do you really know about your own health? Have you been paying attention to your body's signals, or are you dismissing them as normal changes? Many people assume colon cancer is something that only happens to others, but the reality is, it could affect anyone. And the sooner you act, the better your chances of catching it early, when it's still highly treatable. So don't let fear or procrastination hold you back. A simple screening could save your life. If you found this video helpful, make sure to subscribe and turn on notifications so you don't miss more essential health insights like this. And if you know someone who might benefit from this information, share this video with them. You never know whose life you might save just by spreading awareness. Stay informed, stay proactive, and take care of your health, because no one else can do it for you. Hope to see you soon in the next video.